We're taking your calls at 866-870-5752. That's 866-870-5752. And you get a free book when you call the program today, Dr. Darrow's latest, called Stem Cell and Platelet Therapy. Regenerate, Don't Operate is the subtitle. So that should be pretty clear what that's all about. But you got to get the book because the studies are amazing. There's 264 of them. You can also find Dr. Darrow at his computer on his website, just about 24/7, www.lastemcells.com. That's lastemcells.com. Well, during the daytime, you're with patients, but just about all night long, I think, because I've gotten emails from you at like midnight, 1 in the morning. So I know that you really are telling the truth about that you are getting back to people, which is amazing.
What can I say? I love what I do.
It's amazing. 1-866-870-5752. Take a minute to think about the quality of your life if you're suffering with chronic pain, or perhaps you have a loved one, and call and see what Dr. Darrow says about it, because there may be a solution for you right here, right now. 866-870-5752. So I bet you have a question.
Of
like
course.
10,000 of them.
I actually do.
I knew this.
So this one is, my husband's been advised for hip replacement. We found your website. Very much interested and would like to know more. So, yes, we work on hips. Yes, we work on knees. Yes, we work on shoulders. Everything on the body. There's probably not a millimeter of the musculoskeletal system I don't work on. I don't work on neurological diseases. I don't work on eyes. I don't work on diseases, things like that. But anything on your body that hurts you is something that I would probably be able to help you with. I'm not promising anybody anything. In medicine, no doctor should promise. I hear way too many people come in after a failed surgery that has made them worse. And they said, well, my surgeon promised I would be fine after the surgery. And I personally had a lot of training in orthopedic surgery. I didn't become an orthopedic surgeon because when my surgeon did my shoulder when I was in medical school, it came out terrible. And I had done quite a few rotations in medical school and in my internship in orthopedic surgery. I actually, before medical school, started going into surgeries because I loved doing it so much. I used to call around all over town to surgeons and ask if I could please come into surgery with them, and most of them let me do that. But after my failed shoulder surgery, I was like, this is not what I want to be doing to people. There's way too many side effects. There's infections. There's joints that come out bad. I don't even want to get into it and negatively implant you. Some of them work great. I'm not saying forget about surgery, but it definitely should be the very last course of action after you have tried regenerative medicine. So the thing about my shoulder was it got a lot worse for a couple of years. Then I learned about regenerative medicine, and I injected my own shoulder. This is a funny story. My wife was watching TV one night, laying in bed. I hopped into bed to watch TV with her, and I pulled out a syringe.
I love this story.
And I injected I know, it's true. I injected my own shoulder, and she was blasting me with expletives of what I was doing, what the heck I was doing, with other words. And I said, I'm just trying this out. I worked on my wrist, and I woke up the next morning, and my shoulder was 100% healed for 12 years until I re-injured it again. So these treatments are easy, they're quick. You walk in and you walk out of the office, even if it's your foot or your knee or your hip. You still walk in and walk out. So there's very, very few side effects. The main side effect is people get a little bit stiff for a day or so afterwards. But it's about as safe as any medical procedure could be. And I use an ultrasound to look inside the body for needle guidance when I'm doing hips and knees and shoulders, sometimes other joints, because those joints you cannot get into very easily without an ultrasound. Doctors think they are getting into the joint, and they are not. There are studies that show if we do not use an ultrasound or some other guidance, that we miss the joint 1/3 of the time.
Wow.
So be careful. It's easy to use an ultrasound. It doesn't take any more time. Make sure your doctor uses an ultrasound if you're going to get injections in your knees or shoulders or your hips. Years ago, we used to wonder when we'd have national meetings, we'd all hustle around and go, why don't hips heal? What is the problem with hips? We didn't realize we weren't getting into the hip joint because it was dark in there when we put a needle in. It was called blind injections. As soon as I got an ultrasound, hips started healing as well as everything else. So be careful. Watch out.
Our number is 8.
Anyway, yes.
Go ahead. Sorry.
Anyway, yes, we do. God, I have people come in every day. They're advised to have a surgery or a joint replacement. And I move their joint around. And I say, you got a great joint. Why would you want to have a surgery? And they say, well, I have bone-on-bone arthritis. And I laugh and I go, you don't. That joint moves great. Bone-on-bone, what does that mean? It means the cartilage is gone, and it would be like two bricks rubbing on each other. You don't get range of motion. So be careful what your doctor tells you. Don't let your doctor lead you to an unnecessary surgery. Of course, if you have an emergency, go ahead and get the surgeon to fix it. Okay? You were going to say, Nita?
Well, I was going to invite our listeners to give us a call who may be experiencing chronic pain at 866-870-5752. And maybe you have a family member, a parent, a child, a cousin, a sibling that is in chronic pain, and you're watching them not be able to live a full life. And perhaps you'd like to find out about this, and you could call them and get them to listen, or even call in themselves, because this is one of the biggest problems in our country, is people that just tolerate pain. We have 30 to 40% of Americans in chronic pain. We have an obesity epidemic that's hurting people's knees. So it's like a vicious cycle, isn't it?
It is. And we have a lot of depression in our country caused by pain. Either way, you can have pain and get depressed, or you can be depressed and get pain from it. But either way, you owe it to yourself to do whatever you can, follow whatever course it is to try to heal yourself. And unfortunately, Western medicine does not teach healing in the musculoskeletal system. It teaches medication and surgery. And those things typically are not going to help you. They may make you a lot worse. I feel sorry for people who come in on pain medications because it is so difficult for me to get them to quit. We have to wean them off very slowly. And, the truth of it is, I have weaned thousands of people over the last 20 plus years off of pain medicines. And every one of those patients who has quit their pain medicine has felt better just because they quit their medicine. We have this opioid epidemic going on. I don't know what is in doctors' heads to give those medicines to people. They shouldn't be doing it. Those medicines should be used short-term only for a procedure. And I have patients sign something, if I give them a couple, that I'm not going to give them any more later. That's it. We don't want to addict our patients.
No, we don't. Well, how about we go to Dennis?
Shall we go to Dennis? His son injured his elbow. Dennis, Dr. Marc Darrow, how old is your son?
Oh, I can barely hear you, but my son is 15 years old.
Okay. Can you hear me better now?
Yes.
Okay, good. He's 15, and is he a pitcher playing baseball or something?
He's an infielder. We've been playing competitive baseball, but we don't do a lot of heavy throwing. He does lift weights, and he was playing last year, and he was coach had him in the outfield, and after the practice, he said that he had pain in his elbow, so immediately I went to get an MRI, and then I went to Dr. Jonathan Botts, who is out in Van Nuys. and he basically had said to try this PRP shot, which that's why I'm calling. On that, he had that done, doctor, and he's probably heard it in May, and now we're coming into September.
Yeah. Well, first of all, PRP and stem cells are not a miracle cure.
Okay.
So I have to give you that disclaimer. They're something that grows tissue. One treatment may not do the job. You may want to go back to this doctor, and you have to find out if he does this all day long. You want to go to the doctor who does the most. I don't like to pat myself on the back, but I do the most of anybody that I know of in the world. I do about 120 stem cells a month and that many PRP also.
Right.
And I do it all day long, every day of the week. I don't take off much time from work. I don't know if you heard the beginning of the show. I take off like 2 to 4 days of work a year because I love what I do. And I am busy. When you come to the office, you're going to wait. Some people have to wait a long time, unfortunately, because I am busy. And the reason I'm busy is because I get great results. The elbow is very complex. I don't know how it was injected. And often the elbow needs to have more than one injection to heal it. So I can't comment on the doctor you're using. I do know that he is, I haven't heard of him. He's not one of the guys that does, he's not one of the big players.
It's an expensive shot. I mean,
well, it can be, or it doesn't have to be. It depends who does it and who's charging for it.
Right.
People charge all different kinds of amounts.
People, I mean, obviously, you're saying that the stem cell does work if done properly.
Well, nothing's going to work on everybody, Dennis.
Right.
What if I worked on you and you got 100% better, and then you fell down and re-injured it? People have this idea that once things are better, they're going to stay like that for 1,000 years. Well, I don't think that's the case. For my own shoulder, that's been my worst injury. About 20-some years ago, from a weightlifting injury, I had terrible pain. I healed it with one shot. Actually, I poked it more than once, but it was one series. And it was better the next morning when I woke up. It was pain-free, but I can't say it came back. I re-injured a different injury 12 years later.
Well, what would you say on an outset if he got the one shot right now? We kind of shut him down from June through now. He really hasn't. He's just started doing a little bit of throwing. Is that time frame seem reasonable, or should he have?
No, it's not. It's not reasonable. It's not reasonable or unreasonable. It's not healed. By the time he's done getting a series of PRP or PRP plus stem cells, he should feel 100% better. Then he goes back and throws. We don't know if he's going to get better by not throwing.
It should heal fairly quick, like within a few weeks?
Usually in about 2 weeks, we know if a person's healed or not. I generally treat every couple of weeks if they're not healed. I haven't examined him. I don't even know what the issue is.
Should I go get another MRI?
No, that won't tell you anything. Tell you nothing. My suggestion, I don't want to pat myself on the back. Come on in and see me. Let me do a consult. Let me touch the area. The phone number to our office is 800-300-9300. Go to the website. You can watch me injecting an elbow. If I do decide to inject your son, I'm going to probably poke him 30 times. How many times did he get poked?
Yeah. He's done it once. He probably got once, which is kind of confusing to me.
What I'm saying is that one time he got the shot, did he get one poke?
As far as I know, yes.
Okay, well, that is not a big winner in my book, and I'm not criticizing any doctors because doctors use different techniques. I would have poked him at that session about 30 times with a teeny needle, a 30-gauge needle, to in a sense, score that tendon, if that's what it is. If it's a tendonitis, I would go into the joint. I would beat it up so that the tissue has a chance to grow or regrow and bleed a little bit. That's how we heal. I would do probably a tenotomy, if you want to look that up. And there's a lot more to this than most doctors understand. Most doctors go for a weekend seminar and think they can do it, and they don't get great results. So it's what I tell everybody in medicine. I don't care what you're going to do. If you're going to go get a colonoscopy, it doesn't matter. Go to the person who does the most. That just makes sense. Who's been doing it the longest.
I went to one of the best, but basically I researched where he did his therapy and realized that he did all knees. That was kind of why I went to him, and I haven't had surgery again for almost 26 years. So, well,
good for you, man. I'm glad that you are happy, but your son is not happy. And I wouldn't sit around waiting. I wouldn't sit around wait for that elbow to heal. I would take affirmative action and heal it.
I understand. So just call your office.
Any other questions? You can call right now, 800-300-9300. You can see if we take his insurance. We're at near the 405 and Wilshire Boulevard across the freeway from UCLA.
Okay, that's fine. I live out in Ventura County. Okay.
That's fine.
All right,
we get a ton of people from where you live.
Oh, I appreciate it.
Don't get mad at me because I did my residency at UCLA. I went to USC too.
I would never do that. All right.
I went to both schools.
My call. All right.
All right. God bless you. God bless your son.
Okay, Joe in Orange.
Hey, Joe, Dr. Marc Darrow, you've got a sore hip. How long?
Yes, I do. How you doing, doctor?
I'm living it up, but how long has your hip bothered you?
Probably a couple years, but it's not chronic. It's just when I walk a lot. The way I describe it to people, it's got like a click or a pop sometimes, and then it gets sore if I keep walking.
Yeah, that could be a ligament that is snapping there.
Okay.
I'd have to look with the ultrasound inside and take a look and see what's going on.
Ultrasound would be the best way to diagnose it?
There's a lot of ways that can help, but my hands are the best way to diagnose, doing an examination. The other stuff is an adjunct to it. And I see way too many people that come in after failed surgery, and I asked, did the surgeon touch your body? Nope. They looked at an MRI and said I needed surgery. That's not the way to do medicine the way I like to do it. I'm not putting them down because that's what they do, but I haven't found that to work because people that do that often have a failed surgery because the MRI showed something that wasn't relevant to the person's pain. So did you get an MRI? Did you get an X-ray? Did a doctor diagnose you?
I have not. The last time I was in for a doctor visit, he just laid me down on a table and moved my leg in many different positions. It didn't hurt. So he said, well, I don't think you're a candidate for a hip operation or hip replacement. I go, I hope not. But he said,
yeah, I hope not.
Maybe physical therapy or something would help. I tried.
Well, did it help?
What's that? Physical therapy?
Did it? Yeah.
No, I did not go through physical therapy yet.
Okay. Well, there's a high probability I can help you. I have to see you first, but the thing you're talking about doesn't sound very bad to me.
Okay.
You good? You got more questions?
I'm sorry?
You got any more questions? I like to answer everybody's questions. I never let a patient leave my office until I say, have you asked every question you can imagine?
Sure. No, I think.
And the funny thing is, most people say I have one more question. Do you know what one means?
No.
10.
It means 16. I think it's funny. People don't want to ask questions. They think that they're impinging on my life. I'm there to answer all your questions. If I don't know the answer, I'll tell you, and I'll find it out. But I give everybody, when a patient leaves the office, for the first time. They get my cell number and they get my email. And I say, please don't be a stranger, because later on you're going to have more questions and you're not going to be happy unless all your questions are answered.
So I guess my only question would be, I could come in and have a visit or a consultation with you, and you could determine if it's ligaments or joint or something like that.
Hopefully, but the point is not if I can determine that. The point is if I think I can help you heal it. You see, we have too many people who come in and go, I want to fix this tear. I want to fix this thing. And it's not usually relevant. They're not necessarily the pain generators. When someone comes in with a meniscal tear in their knee and says, my surgeon says I have to cut that out because that's where the pain is coming from, I have to educate them and let them know that when we do MRIs of people that have zero pain, they often have meniscal tears. So we don't go do surgery on things that may not be the pain generator, the thing that's causing the pain. When I would treat your hip, I would treat the whole hip. It may not even be your hip that's causing the problem.
Right.
It may be nothing to do with your hip that's causing that problem. There are way too many people that get hip replacements, the surgery fails, and they come to me, and I touch the area where their pain is, and I go, that wasn't your hip. And they go, you mean I had a surgery for nothing? And I go, well, I don't have the answer for that, but it wasn't your hip.
Yeah, I understand. I had lower back pain years ago, and I thought it was my leg. It went down to my knee, and the doctor said, I'm not a betting man, but I'm pretty positive it's in your back. So I think you're right. Nerves can do a lot of different things, cause different pains in your body.
Well, I mean, if we talk about the hip, we've got the tendons that attach the leg to the pubic bone. So that's close to the hip joint. We've got the greater trochanter on the outside of the femur, which is a lump there of bone that 14 muscles attach to. There's just too many things going on there for someone to do an MRI or an X-ray and say you've got arthritis in your hip and I'm going to operate on your hip. You can have arthritis in your hip and have no pain.
Wow.
You got to find out where the pain generator is.
Yes.
Images are not the way to find that. It's a good adjunct to help you out. I had a woman come in yesterday with advanced, called end-stage hip arthritis. She's one of the most active people I've ever met. I said, how much pain do you have? She goes, not much.
Oh, dear, we are out of time. Sorry, Joe. Thank you for your call. And Sandy, please go to the website, www.lastemcells.com. That's lastemcells.com. And thank you, Mark. Thank you, Alex and Nick and everybody behind the scenes. Thank you, callers. Please remember to join us next time. Remember to listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens. Thanks for listening.